I was back and forth on the fence for several years with the breast augmentation and lift procedure, basically because of my fear of scarring. But Dr. Karamani was able to alleviate those fears, and I've seen his procedures, so I knew exactly what to expect with that. And I elected to go with the silicone implants. So I'm able to tell my patients now, because the FDA just did release the silicone implants for general use, that, I'm very, very pleased with the silicone. It's not something to be, scared of. They've done their research and it's been noted to be okay.
I just wanted something that I looked a little more, feminine, and, not only was I flat, but my skin wasn't very tight, and it was almost like he did it over the muscle, so he also did a lift with it. So it wasn't like a natural lift. And so I was able to wear things that I couldn't wear before. So, my friends are very jealous. Like, they'll go out, they'll be like, oh, we don't want to go out with you because you get all the attention. So.
Well, I have 3 children, and after having the 3 children, my body was not at all what it used to be. And so my goal was just to be restored to pre-baby, nothing, exaggerated more than what would fit my frame.
Dr. Karamani performs several different breast procedures, including breast reduction, breast lift, and breast augmentation. If you wish your breasts were larger, fuller, or more shapely, breast augmentation surgery may be the right choice for you.
The most common reason patients come is because they feel their breasts are disproportionate to their body size. A lot of women, their breasts really never developed to the size they want it to be. Or if they had, following pregnancy, they've become smaller and have lost volume, and then want to kind of go back to where they started. In general, when I see a patient for a breast augmentation, there's 4 questions that we have to answer, and we do those together. One is size, and I get a good idea of that by finding out what's their current bra size and what their ideal goal would be. The next 3 are what incision to use. The 3 most common are around the areola, in the fold of the breast, or in the armpit. Where the implant goes, whether it's under or over the muscle. There's different reasons I do both. And finally, what type of implant, whether they use silicone or saline.
So the FDA has recently approved silicone breast implants. What does that mean now for the patients?
Well, it means they have a choice. After a very long investigational period, the FDA has determined that silicone implants are safe for patients. I think that silicone feels and looks more natural. Or patients have to be 22 years of age to get it. It does require a slightly longer incision to place the implant, and they are more expensive than saline. Some patients still have some concerns about silicone just because of all the press and the history, and for those patients, saline is an excellent choice.